Case study: infusion-related reactions to Taxol, Paclitaxel, Taxotere, Docetaxel, and Abraxane, Nab-Paclitaxel. Patient presentation: 55-year-old female with breast cancer, recently started on chemotherapy. Within minutes of starting her first Taxol infusion, she begins to experience fever, flushing, and shortness of breath. Immediate cessation of infusion and administration of antihistamines and corticosteroids show improvement in symptoms. Medical discussion: Taxol, Paclitaxel, is formulated with Cremophor EL, which acts as a solubilizing agent but can also cause infusion-related reactions due to hypersensitivity. The exact mechanism is not completely understood but may involve an allergic or immune response. Taxotere, Docetaxel, has fewer incidents of infusion reactions compared to Taxol, likely due to its formulation with polysorbate 80. Abraxane, Nab-Paclitaxel, is even less prone to causing infusion reactions because it is a nanoparticle albumin-bound formulation that does not require Cremophor EL or any other potentially allergenic solubilizing agents. The discovery of the anticancer properties of the Pacific Yew tree, Taxus brevifolia, is an interesting tale of scientific investigation and serendipity. In the early 1960s, the National Cancer Institute, NCI, in the United States started a program to screen various plant samples for potential anticancer activity. The program involved collecting thousands of plant samples and testing them on cancer cells in labs to observe any signs of anticancer properties. The bark of the Pacific Yew tree was one of these thousands of samples. Initial tests in the lab showed that an extract from the bark had the ability to inhibit the growth of cancer cells. Further investigation led to the isolation of a specific compound responsible for this effect, initially referred to as Taxol, and later renamed Paclitaxel. The active compound was found to have a unique mechanism of action involving the stabilization of microtubules, which are essential for cell division. By stabilizing these structures, Paclitaxel effectively stops cancer cells from dividing, leading to their eventual death. However, one of the major challenges was the low yield of Paclitaxel from the yew bark, which led to concerns about the sustainability of harvesting from the limited natural resource. This challenge was later overcome through semi-synthetic production methods and the development of related compounds, such as Docetaxel, Taxotere, which have similar mechanisms of action but are easier to produce. Facts: 1. Taxol was one of the first plant-derived anticancer agents and is obtained from the bark of the Pacific Yew tree. 2. Taxotere is a semi-synthetic analog of Taxol and is generally considered to have a more favorable side effect profile. 3. Abraxane is unique in that it utilizes albumin-bound technology to deliver the drug, minimizing the need for potentially allergenic solubilizers. 4. All three drugs are used in the treatment of various cancers, including breast, lung, and pancreatic cancers. Summary: given the patient's adverse reaction to Taxol, future chemotherapy regimens may consider the use of Taxotere or Abraxane, as these have a lower incidence of infusion reactions. For more information, consult the National Cancer Institute's drug information pages or speak with an oncologist experienced in the treatment of solid tumors.